I think overwhelmingly, of course, what never gets discussed on TV or in the mainstream media or even at work. When I show people at the hospital that the tests that are utilized for detecting the virus are faulty, many are particularly surprised. Many medical workers are unaware. Some are starting to understand what has been unfolding. Some realize things like the flu have just literally disappeared from the hospital, cardiac disease, many of the other diseases that we used to treat at the hospital have basically all but disappeared. And so, of course, something that doesn't get talked about enough to the extent that it should, so that many individuals have a more deeper understanding of the severity of the pandemic. And so this is actually from the journal Providence, right? This is from Rhode Island. This is actually back on 7/18/2020. It says nursing home workers among those who received a false positive test. It says more than 100 Rhode Islanders who tested positive earlier this month received a false positive test result and were not actually infected with the novel virus. This is according to the State Department of Health. Of course, this came out Friday back then. There's 113 false positive tests were processed by a private laboratory in New York that works with East Side Clinical Laboratories. The health department stated in a news release that the false positive tests were reported between July 9th and the 14th and were part of a much larger batch of samples from other states. It doesn't go into whether or not some of the other batches were also compromised, right? So it goes on to say the health department and the East Side Clinical Laboratories, they have been working to contact these individuals and their contacts. The new release status is all Rhode Islanders who have been tested for the virus should assume that their test is accurate unless they have been contacted and directly told otherwise. And I would say, realistically speaking, what are the chances of them actually giving the full details of what's been going on? You know, as a longtime investor, so there was an investor by the name of Charlie Munger. Many people are familiar with Warren Buffett. Charlie Munger is Warren Buffett's partner, and so he had a saying: "You show me the incentive, and I will show you the outcome." And so, for many of these businesses currently, especially because many people have lost their jobs, many small businesses have been closed, testing for many of these medical facilities, because maybe patients are not going to these clinics as much as they used to for fear of being in small, tight-knit areas and contracting the virus. There have been many clinics in the area that have closed down as a result of, they've removed like surgeries, cancer treatments, etc. Like a lot of these clinics that did other things basically stopped doing all of those things. And, numerous people reported, having cancer spikes, or people who were in remission and then coming back because of X amount of months of basically not being checked and then finding out that their cancer is back. And so the incentive overwhelmingly, because there's a financial incentive, just like the hospitals have a financial incentive, as under the CARE Act, they receive more money for a C19 diagnosis. They receive more money when a person is intubated. And so since there's a financial incentive for all of these things, more than likely it is what is leading to the outcome, right? Show me the incentive, a financial incentive. The outcome will more than likely be you will see more of whatever it is that is being incentivized. And so when I see things like this, in my opinion, is more than likely the tip of the iceberg. And of course, they will go on to say that it was a mistake, that they've done an internal audit and everything is okay, as it says here. As it says further down here, that they've done an internal audit, and if you shouldn't presume that there's anything wrong with the remaining batches. But of course, in the very beginning, it does go on to say that the false positives were reported between July 9th and the 14th, and were part of a larger batch of samples from other states. So not only was this laboratory responsible for the tests here that were done for these people in Rhode Island, but they were also responsible for other batches in other states. And more than likely, if you were seeing this many high false positives, more than likely you would see many other high numbers of false positives coming out of this laboratory, but would just not be spoken of because of the incentive.